Ooh, welcome, welcome, welcome. Welcome to this live. Welcome. Thank you for joining in. Let me know who is here first to join and first to drop a comment. Oh, Village Nurse Evelyn. Wow, good to have you here. Welcome. Thank you for joining in. Welcome. I believe I'm audible. Can you hear me clearly? Please confirm that you can hear me. Nurse Evelyn, please confirm that you can hear me. Oh, okay. Thank you. Thank you for joining in. Wow. Thank you for joining the live. We are talking about high blood pressure. Are you a nurse? Are you a certified nurse? Are you working as a nurse? Village Nurse Evelyn, I think I'm subscribed to your channel. I think I've seen your channel and some of your videos before. Please confirm where are you watching from? Where are you watching from? All right, thank you. All the way from Ghana. Welcome. So, how is Ghana today? How was your day? What time is it in Ghana? One common medical condition that it's of great burden all over the world. At least 5 adults may actually be suffering or dealing with hypertension, and people have questions, different questions, concerns around hypertension. And so we'll be looking at one very important question and some of the questions that you may have regarding this medical condition. All right, so I am bringing to you live at this time to talk about the changes that you can make actually when it comes to lowering your blood pressure if you are dealing with high blood pressure. Okay, a number of people have come across patients, individuals who do not like to take medications. Okay, so what about you? Let me know in the chat. Um, do you like taking medications? And if if no, and you are dealing with a medical condition that requires medication, then that's going to be a great conflict. All right. So, how are you doing today? Where are you watching from? And what time is it in your location? I can see village nurse Evelyn here, first to come on live and first to engage in the chats. So, welcome, nurse. And how are you doing? How is work? As we get into this discussion tonight, okay, it's night um, in Lagos, Nigeria. So let me know where you are watching from and what time it is in your location. Interestingly, people are in different time zones, and so it's understandable that some may be at work at this time, busy day, busy afternoon in most parts of Europe, while in some other places, like this side of the world, Africa, you have evening and then people moving to the night season. So, what do we need to know when it comes to dealing with high blood pressure? Okay, over time, I've talked about what high blood pressure is, what elevation of your blood pressure means, and what it means to be diagnosed of hypertension. And if you, as an individual, has been diagnosed of hypertension, it's not the end of the world. Okay, quite a number of people who have that diagnosis, and many have been placed on medications. Some have had to probably suffer from complications from failure to use their drugs or poor management of their condition. Some people have actually done well, living decades without experiencing the full manifestation of complications from hypertension. So I want to encourage you, uh, don't uh, don't see it as the end of the world if you have that diagnosis. There is always a way out. Interestingly, there are some people that have that uh, diagnosis as a temporary thing, not necessarily a permanent condition. Okay, so it could just be a brief experience of elevation of blood pressure uh, due to stress, some stressful events, and as I mentioned, sometimes may be related to pregnancy, and most of the time, people are able to recover, and in fact, even if they initially were placed on medications, they could be asked to stop taking medications once their blood pressure is normal. So, but I need to put a very important point here, that based on some of the things I've seen relating to individuals who are hypertensive and who need to take uh, medications, some of the people decide to stop taking medications, decide because they feel their blood pressure is well controlled. Okay. And what many of those people do not know is that, and I try to educate my patients, is that such a change or control in that blood pressure is most likely than often related to the use of the medication or medications for control. Okay, so once the individual stops, decides to pause on taking medications, or chooses to take medication only when they feel that the blood pressure is high, then such an individual is at risk of developing complications from hypertension. Okay, so if you have that experience, you may find out that when you stop taking your medications, after some time, you see the blood pressure measurements rising into the hypertensive range. And if that is taking place and you choose to go back to taking medications, in a way, you are not allowing the medications to work in a systemic and progressive manner, uh, as to control your blood pressure. All right. And most of the time, the advice is that you have a proper recording of your blood pressure as requested by your physician, and then that you are able to also note or be reminded that this medication is expected to be taken daily, regularly, preferably at a specific time or period of the day. All right. So, why some people have poor control of their blood pressure may be related to the fact that, of course, some choose not to take the antihypertensive at all, while others who do are irregular with the uh, dosing, whether in terms of the quantity or in terms of the timing, frequency of uh, the medications. All right. So this set or this kind of people or patients may have complications, and the complications from poorly managed hypertension are disabling many times. You're talking about a stroke, talking about myocardial infarction, talking about chronic renal failure. There are many events that could occur that could change the entire life, the life of such an individual. And when this happens, it doesn't just affect the individual, it affects families, communities, and even the nation as a whole. So it is important to note that following proven ways, recommendations for management of your condition, be it hypertension or any other medical condition, is very important. And for those who do not also have control, there are probably those who are not engaged in other things. Interestingly, the World Health Organization has said that even uh, lifestyle changes is actually the first step when it comes to management of hypertension. So whether you have to start medications for control of your blood pressure, or you do not need to be on medication, or you choose not to be, or your physician decides not to start you on medications, you need lifestyle changes. Okay, that is very important, whether you are taking medications or not. And there are people, like I said at the initial stage introducing this, there are people who do not like to take medications. So how do you think it's going to be for someone who has a diagnosis of hypertension, or also has a diagnosis of diabetes? How do you think such an individual can cope? Individual that does not like to take medications. So there are a lot of things that go into this. The aspect of helping the individual to understand, and that's the work of the medical team, uh, helping the individual to understand the need for medications. And then medical team generally will involve the doctor, the nurses, uh, nutritionist, clinical psychologist, pharmacist. So it's a team approach. It's a team approach that we give to this management. Interestingly, there is the need for social support. Family support is also very important when it comes to the management of hypertension. Please let me know where you are joining from. Welcome. Please drop a comment in the chat. So let me know where you're watching from. Where are you watching from? So we'll be looking at the ways by which high blood pressure can be lowered with or without medications. All right, so we're going to start with one very important approach, and that is proper or good hydration. All right, good hydration. Water is important. Water is life. Interestingly, the human body is actually made up of 60 to 7% of water. Our organs, our cells, the tissues in our body, uh, they function well when they are well hydrated. Your cells are able to perform better, able to build, regenerate better when the level of fluid in the system is within the normal expected range. Okay, but when there is dehydration, that poses some disturbance to the normal system. The way the cells are to function will be disturbed. Okay, the blood flow will be reduced. Okay, the same way an individual who has arthritis or any form of bone disease, once there's a shortage in blood supply, once there's a sluggishness in the flow of blood to that part, individual may suffer some symptoms, including pain. Okay, so when uh, there is dehydration, the blood may be thicker than normal. The blood vessels may shrink, and this may put some pressure not just on the vessels but also on the heart, and this can worsen high blood pressure. So dehydration can worsen high blood pressure. It can make your heart to work and pump more than it should be working. So, what should you do? You should ensure that you are rehydrating well. For you as an adult, you need at least 3 liters of water per day. Maybe about 2.7 liters for women, 3 liters for men. And this is very important. You need to be intentional about this, whether you are being managed for hypertension or you are free from any medical condition. This is one healthy habit. Many people wait until they feel thirsty or they are dehydrated before they drink water. That is not actually good, okay? You need to ensure that you are just moving along, moving with water everywhere you go as much as possible so that you do not have any excuse for not taking water. All right. So, water is very important. Interestingly, you can start your day, you should actually start your day with water, waking up rather than going for any colored drink. You go for water, get rehydrated. Proper hydration can help to lower our blood pressure. Next is the need to walk. Physical activity is important. That cannot be overemphasized. We live in a sedentary world at this time. People are becoming more inactive than before. All right. So when that happens, it puts people at risk of a reduction in the ability of the heart to pump more and then to circulate blood to different parts of the body. Now, physical activity actually helps to relax your muscles, not just your muscles, helps to relax the blood vessels that carry blood to different parts of the body. And then that helps in maintaining a proper blood pressure. So, what should you be doing? You should be engaging intentional engagement in physical activities. Okay, not just that's beyond, I'm saying beyond your routine, beyond your normal work demands. You should be intentional. There are times that you may need to park to take a walk. There are times that you may need to wake up early, do your morning workouts, just do 20 to 30 minutes of physical activity. Exercise is part of it. There are other activities that you can do, gardening, make some form of movement rather than being sedentary. And if you have to work remotely or you have to work at your desk for hours, you must practice the need to make sure that you are standing at least within an hour of work. Just make sure that you stand to stretch. You can even help yourself to prevent chronic back pain. A lot of people complain of low back pain, and many of these are related to either being sedentary, not moving, or standing, prolonged standing. So those are conditions that could also develop from inactivity. So you need to be walking. You need to stretch. You need to make those movements, and that way you will be ensuring that your heart is in shape and your blood pressure is well controlled. Now let's talk about salt intake. Now the recommendation is that you do not take more than 2 grams of salt in a day. All right. So, and there are many sources, many ways by which we take salt. Even if you don't add table salt to your food, If you take seafoods, highly processed foods, fried foods, you have the tendency to take more salt, especially sodium salt. So, what should you be doing? Be conscious of the labels, check what you are taking, and be intentional in terms of the moderation when it comes to adding salt to your diet. So, too much salt actually retains water in the body. And when this happens, salt in the body draws water, increases the pressure that 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 occurs in the blood vessels, so leading to elevation of blood pressure. What should you be doing? You should reduce highly processed foods, snacks, noodles, adding seasonings, canned foods, high level consumption of seafoods. All this should be reduced. You can go for natural things like ginger, garlic, onions. These are natural things that you can take in the place of adding more salt to your diet. Okay. Next is the need to replace these things, I mean, those processed foods, with high potassium foods rich in potassium. And these include bananas, beans, sweet potatoes, avocado, spinach. These are good sources of potassium, which are helpful in maintaining blood pressure. They are very helpful. So let me know where you're watching from, and if you can hear me, please let me know in the chat. Let me know in the chat if you can hear me. Let me know if you can hear me. Okay. Okay, let's move on. We talk about the need to avoid some things. We talk about the need to avoid excessive consumption of sodium salt. And we should also look at the need to stop alcohol and to quit smoking. If you do, alcohol actually does no good to your body. It actually raises blood pressure, can even damage the liver. There is the effect of smoking on the blood vessels, can narrow the blood vessels, can damage the walls of the blood vessels, and this can actually worsen blood pressure. If you drink, you have to watch and be sure that you are not engaging in this habit to worsen your condition. So, but my advice is that stop alcohol, stop smoking, replace smoking with exercise, or doing something else in place of that, something that will benefit your health better. Let's look at the need to maintain a healthy weight. So, overweight, being obese are risk factors for developing hypertension. And interestingly, there are studies that have shown that people who reduce their weight also have some level of reduction in their blood pressure. So what happens is that the extra weight actually forces more activity of your heart to pump blood, and then increases your blood pressure. So even losing some percentage of body weight, 5 to 10%, can lower your blood pressure significantly. And what should you be doing to ensure that your weight is within the normal? When you talk about your body mass index, that has to do with a calculation of your weight over square of your height. And for normal range, it should be between 18 to 25 kilograms per meter square. But anything below that, of course, is malnutrition, undernutrition. But if you have anything above 25, yeah, now in the overweight range, 25 to 30, and any value above 30 means that the individual is obese, and this has its risk. So what you'll be doing, reduce high consumption of carbohydrates, be moderate in your consumption, engage in consumption of vegetables and fruits, and rich proteins. You have legumes, you have nuts, you have apples. These are heart healthy foods, and this can help significantly in maintaining healthy weight. Other things that you can do include engaging well in physical activities. Exercise should be part of your daily lifestyle. I've said it that according to even the World Health Organization, lifestyle approach is still very important. Interestingly, the first step when it comes to the management of hypertension. So healthy weight is important. Next, let's talk about the need to check. If you're not checking your blood pressure, you may not know what exactly the values are. So, because there are no symptoms usually, people begin to get symptoms when the levels are significantly high, and sometimes when complications are setting. So, regular check is important to help you to detect any changes in your blood pressure. So, you need to have that the electronic blood pressure monitor, and that can help you to monitor. You can check in the mornings, you can check in the evenings, and there are ways to check, and there is a pattern of checking for you if you have not been diagnosed of hypertension, and for any individual that has a risk of developing hypertension, then there is the pattern of checking. For those who are hypertensive, of course, you need to follow your physician's recommendations. So that's very important. Next, let's talk about the need to engage in quality sleep. That cannot be overemphasized. Poor sleep actually stresses your hormones. I mean, increases your stress hormones, and this can significantly raise your blood pressure. So, what should you be doing? You should be aiming for at least 6 to 8 hours of sleep, quality sleep, not just the duration, but ensuring that you have a restful, restorative sleep. Avoid screens before sleep, before bedtime. Ensure that you sleep in a noise-free environment. Ensure that sleeping in a dark room will be better for you, and you can definitely see your doctor if you have any challenges with your sleep pattern. All right. So that's one of the other ways by which you can lower uh, high blood pressure. Okay, next, let's talk about the need to engage in deep breathing. Deep breathing and meditation can help. You need to note that stress hormones raise blood pressure. Cortisol, adrenaline, when secreted in high levels, can increase blood pressure. Breathing slowly helps to calm your nerves. When you engage in meditation, in prayers, these are very important to keep you calm, because your spiritual health, your mental health also affect and reflect on your physical health, even your blood pressure. Okay, so that's why if someone is stressed, definitely they can have elevation of their blood pressure. Okay, I think we are almost done with the points here. Okay, the next and last but not the least is to ensure that you are consistent with these lifestyle changes. Many people know about these lifestyle changes, but knowing isn't enough. You need to be engaged. You need to engage in these activities. And when you do, when you are consistent, you get the results. Lifestyle changes work when they are done daily, not once in a while. People say, oh, they exercise, but they do so once in a while. People say they hydrate well, but they do so once in a while, which may not be too helpful if you are thinking of making, excuse me, if you are thinking of making significant changes to your health, even your blood pressure. So you can start with one or two habits and then build up on this. High blood pressure is a silent killer and it's preventable. It's actually the leading cause of cardiovascular diseases worldwide, which is the leading cause of deaths globally. So these are preventable deaths. These are that deaths that can be avoided. What are the things that can be done? They are just some of the things I've just shared with you. They are simple as that, but how many people are actually committed to doing the needful to ensuring that they prevent experience of high blood pressure or having a poor control of their blood pressure. All right. So I hope you got those points, and then let me know what you think in the comments. Let me know what really struck you, or which points, which of those points really struck you. Uh, Thank you for watching. If you have any question regarding this topic, kindly drop in the chat. Okay, so thank you for watching, joining this live. If you been able to note the points, I want to encourage you to engage practically in doing those things that are healthy. If you are just joining the community, welcome. Uh, Thank you for subscribing, and remember to click on the notification bell to receive all notifications from the channel. We'll see you again soon. Thank you for watching, and bye for now.